Hello and welcome to the Art of Being Human. There is a lot of talk today about opioids and what they are and how dangerous they are and how they lead to heroin use, and we have a terrible problem in the state in terms of heroin abuse. All kinds of people taking it, all kinds of people dying from it, and even though there are medications and shots that you can take to reverse the effects of heroin, it's still a very, very dangerous problem, because even if you have a person who had too much and has overdosed on heroin, and they give him a medication, they give him a shot to bring him back, what he usually does, if he's not mandated to go to some kind of a health care or rehab program, they go right back and take it again. And my fear is when they go back and take it again, they're doing it because they assume, one of the reasons they're doing it is because they assume that they're going to be saved by another shot of the medication that'll bring them out of it. So it gets to be a cycle. Well, we'll take it, we'll be saved from it, we'll take it, and it becomes almost an excuse for doing it over and over and over again. Now, I don't know how many people actually feel this way, but it is an issue that has come up. And you use your Narcan on every person or one person over and over and over again. But I do want to get into it because people do have a lot of pain and they need to have relief of that pain. Who wants to sit there and be in agony? You know, that's no fun, and you do need to have pain relief, but some of the pain relief is very, very strong, and it has to do with narcotics. So let me just go into the analgesics and tell you a little bit about them and how it can lead to heroin addiction. Pain relievers are called analgesics, and you have two basic types, actually three, but I'm only going to be talking about two different types. And the opioids are narcotics, and that would be like hydrocodone, methadone, oxycodone, and they're all chemically related to morphine. You may not realize that, but these medications that are strong painkillers are always related to morphine. Now, I can remember when I was in the hospital after a heart procedure, and I was having quite a bit of pain, and I finally told the nurse, I don't know if I can stand much more of this. They were aware of the pain. So they said, we'll give you some morphine, but they had to get the doctor's permission. So they gave me some morphine, and it was in my IV. I don't know how much they gave me. They said they were going to give me a small dose, but I reacted to it. I started itching. I was just digging myself. The pain went away, but it only went away for 2 or 3 minutes. And the rest of the time, I was just scratching myself everywhere, just intense, intense itching. I was thinking, I'd rather have the pain. Well, I don't think they gave me too large a dose because it didn't last too long. Finally, it just kind of phased off, and I was back to having pain again. And I thought, which of the two do I prefer? Digging myself with such an intense itch I can't stand it, or having pain relief, or having pain because I'm not having the opioids. I don't know which is worse, but I decided that I'd almost rather have the pain than the itch. Do you know how irritating it is? You must, because everybody's done this. When you have an itch, and no matter how much you scratch it, it itches more. So it's like you can't get relief from it. You have to scratch it because it's the only way to get relief, but then as soon as you stop scratching, it comes back and it's worse than it was before. So you try rubbing it. You try putting cold water in the area, any way to slow down that itch. Well, it's a terrible itch, and if you're getting it because you're having a reaction to morphine, that becomes exaggerated, and I don't think I had that much, because I came out of and went back into the pain in about 3 or 4 minutes. But at any rate, it's nothing to mess around with. So these opioids are narcotics, and generally speaking, related to morphine. Then you have the non-opioid analgesics, and they're going to be like aspirin, acetaminophen, ibuprofen, Celebrex, and things like that. They're not drug-based. They're not based on a narcotic, but they can still be quite effective. Some are more than others. So morphine, to get back to the opioids, morphine comes from poppies. and plants, and it can also be produced in labs. I think most people get it from being produced in labs, and it is effective in controlling pain, and higher doses of it can become addictive. Now, I have had hydrocodone, oxycodone, as a result of surgery that I've had. And I didn't think it was all that helpful. This is just my own personal experience with it. I didn't think it was all that helpful, and there wasn't any chance that I was going to keep taking it, and there wasn't any chance that I was going to become addicted to it. I'd just as soon leave it alone and take something that was not drug-related, not a narcotic, and I got as much relief from it. But there are side effects also. If you're going to take these high-powered drugs, it can cause that are based on narcotics. It can cause constipation, drowsiness, and nausea. And too much of an opioid can cause breathing slowdown and coma. What we have to realize about the drugs, if we take drugs for pain control, and I'm not saying we shouldn't do it, because some people have a real need to take drugs and they need to be on opioids, but if we can get addicted to them fairly easily, so it has to be carefully monitored. And what happens is it can slow down your breathing, and then you can go into a coma, and then you can die. Now, sometimes those opioid drugs for pain control are so expensive that what people do is they make a shift and they start taking heroin instead, because heroin, of course, will act as a painkiller, but it's also terribly, terribly, terribly addictive. Now, what I want to tell you about heroin, it's the first thing I want you to know about heroin. Heroin actually shrinks the brain. It shrinks the brain cells so that the mass of the brain is smaller. It's not normal size anymore. Now, there's no fixing it. It's permanent. But what happens is that you have more spaces. Let's take a look at this brain chart that I have, although I wasn't going to use it for this. So here's your normal brain. And you have room for the tissues, and then above that you have your skull. What happens is this whole brain shrinks, and that leaves a lot more spaces. And what happens with these extra spaces, the brain is smaller, so you have increase in the spaces. Well, it all fills up with cerebrospinal fluid. And the cerebrospinal fluid is fluid that travels around the brain and down the spinal cord. So it just flows around, and it does is it's a circulatory thing. It goes around the brain and it goes down the spinal cord, and then it goes back to the brain. It circulates between the brain and the spinal cord, and that's perfectly normal. So when that brain gets shrunken up and it's smaller size, what happens is that you get the cerebrospinal fluid filling in all the extra spaces where the brain was. Now, at that point, there will be physiological changes to the brain, both the gray matter and the white matter. And because you have gray cells and you have white cells, they're both affected. There are physiological changes to them. There are chemical changes to them. And then the next thing you know, you've got symptoms of Alzheimer's. And the symptoms of Alzheimer's that you start getting dementia. You can't think right. And then with the dementia, it gets worse and worse. And the problem here is that there is no fix. If you're hooked on heroin, then at some point in time, now a lot of how fast this happens is going to depend upon how much you have, how much you've taken. But what happens is the brain is going to shrink. You're going to fill up with cerebrospinal fluid, and then you're going to have brain changes, changes to the brain cells. The brain cells will develop the plaques and everything that you get in Alzheimer's. You have the beginning of Alzheimer's disease. You get dementia. It gets worse and worse and worse. And that's the result of heroin. Now, people do get dementia for other reasons, but you can get dementia if you're using drugs, and the drugs, certain specific drugs, have that effect. Heroin is one of them. So we have a massive amount of people using heroin that shouldn't be using it. They've got hooked on it. Some of them have got hooked on it because they were taking legitimate pain medications that were opioids that were related to morphine. The medication became too expensive, And they made that switch to heroin, never thinking that once you start heroin, you can become addicted on your first dose and not be able to get over it. Now, the problem with addiction is this. Everybody says, get off from it, get off from it, get off from it. And you understand, and you may want to get off from it. But the problem is that once you get drugs in your system, and heroin isn't the only one, there are others as well, but we're talking about heroin, and heroin also does it. Once you get heroin in your system, it changes the way your brain is. It changes the way your body functions. You can't, by your own will, get out of it. It's very difficult to do that, almost impossible to do that. And it's not because you don't want to, because you want to restore your life again. But the problem is there have now been tissue changes, damage to your brain cells, and so therefore your brain is not functioning in the normal way that it would. And what happens is that you can't get off from it because there are so many changes to your brain, so many changes to your body cells that your body absolutely demands it, and you can't get away from that. It's not a case of will. It's a case of where will cannot predominate because of the changes in the cells in your brain. So this becomes a very serious thing. You can become addicted on that first dose. So if you're taking opioids, you have to be very, very careful, and your doctor should monitor you to make sure that you don't get too many. And if it gets too expensive, something else could be tried. But don't go to heroin because you can't afford your medications. There has to be something better than that. And yet I do understand that pain has to be controlled. You can't live your life in constant pain all the time. That's no kind of life at all. But at the same time, you don't want to go the route of getting involved in drugs, and then you are such a drug addict that you live from one shot to another shot to another shot, and you have no quality of life at all. It's a case of where am I going to get my next fix? You see, so it's a dangerous path. We use more drugs for pain control, but the pain is serious and it has to be controlled. And I do understand that. I do understand that. Pain is an awful thing, but you don't want to be a drug addict either. There has to be something in between. There has to be a way to help people so that they don't turn to drugs and then get hooked on the drugs. It's just something that I get concerned about, but it does shrink the brain. Okay, heroin use has more than doubled in the last 5 years, and many are dying of overdose, and many are addicted because they couldn't afford their opioid medication. And pain meds are expensive. They're really expensive. In fact, every medication is expensive. If I buy a medication that was $5 last month, it may be $15 this month. You know, I really do think insurance companies are very greedy, and if they can make you pay more because it's medication you absolutely need to have, then they'll do it for the sake of their profit. And I question sometimes the moral laxity, that I consider moral laxity, of some of these insurance companies. But some drug traffickers will put heroin in pain meds and cause addiction because what a drug seller wants, he wants you to be addicted to it. So it's a problem. Heroin kills more than other drugs, and what addicts want more than anything else is just to be left alone to use the drug. You know, they complain because they feel alone. They have a lot of aloneness. No one's around them. But at the same time, they crave that aloneness because they want to be alone to use drugs. And nothing else matters except the drugs. And this is the same for alcoholism. People will go into a hotel and they'll just bring their alcohol with them and drink and drink and drink. They just want to be left alone so that they can drink. You know, it's interesting. You can die if you take your alcohol, and as you're withdrawing from alcohol, you can die from an alcohol withdrawal. You generally won't die of a heroin withdrawal, but the pain of it is still the same. The most common emotion for people using heroin is isolation, but it's also sought out. So there's a 60% rise in deaths from heroin just in the last few years. People get addicted to prescription drugs, and then due to the expense of the prescription drugs, they change to heroin. Now, there is a predisposition, I think, for drug use. Some people, when they use drugs, they will get addicted right away. They can get addicted on the first dose. And that's not only heroin, but also alcoholism as well. Some people are just very, very genetically predisposed to using drugs. Others are not. Others can drink socially for years and years, and they may never get addicted. But there are certain genetics in certain people that will cause people to become addicted right away. Now, what happens when you use heroin? You get a surge of dopamine. Dopamine is a neurotransmitter, and it makes you feel very, very good. It gives you a sense of euphoria, and that goes into the spinal column. Then your breathing decreases. You're not breathing as fast. You can actually stop breathing. Pupils will constrict so that they're like pinpoints. You'll have a dry mouth, decreased bowel mobility. One of the problems that people have who are using opioids for pain medication is that they become very constipated, and you can have an infection of heart and lungs. Now, as I said before, you won't die from a heroin withdrawal, but it's very hard to go through. Alcoholics just want to get high, and that's the same as it is for heroin users. It takes about 6 or 7 attempts at rehab before people actually have success at going to rehab. They start going, they pull out. They start going, they pull out. And usually it takes about 7 tries at rehab before they have any success at it. But rehab is important. And the first few days are the most difficult of the symptoms. There are a lot of symptoms. So when you have a narcotic addiction, you have strong psychological and physical dependence on the drug. You've taken the drug, you are now dependent on it. And my definition of addiction is when you stop wanting it and then you turn out that you need it. And then you take the drug because you need it, not because you enjoy taking it. It's not fun any longer. It's a demand that your body makes of you because of the fact that the body chemistry has changed. It's changed through the use of the drugs to begin with. A tolerance develops, and so that you have to have more and more and more of the drug to get the same effect. And also, people take more and more in order to prevent withdrawal symptoms. Withdrawal symptoms are so bad that people take the drug and continue to take the drug just to stop the withdrawal symptoms. So when they go into a treatment program, they can't continue taking all those drugs. The withdrawal symptoms have to be managed in another way. Going through withdrawal is very, very difficult. I know I heard one woman say, at first she thought she was going to die. She was afraid she was going to die. And then she said, and then after that, I was afraid I wasn't going to die because I'd rather be dead than to go through this. Now, the narcotics used for medicine, for medically induced drugs, is codeine, which has a low dependence, oxycodone, and morphine. And the tolerance will develop within 2 or 3 days of taking the use, of continued use of the drugs. Other symptoms: constipation, a flushed, warm skin, low blood pressure, itching, and that's what I got from the morphine, constricted pupils, drowsy, slowed breathing, slowed heart rate. Those are some of the symptoms. Now, use of drugs, I think probably I'll close it here, but I have a whole list of symptoms that happen if you get hooked on drugs and what happens to you. And I'm going to be starting with this next time. We'll be going into heroin, morphine, codeine, Demerol, Percodan and opium, just because they're all related. They're all drugs. They're all hard drugs, and they're all related. But people get into them sometimes for pain control. They get into it for other reasons. Sometimes just curiosity. They want to try it. This would be more typical of teenagers. But it's a very, very problematic thing. And in this state, it's a very bad. We have to deal with it, and it's a very bad thing. It's like an epidemic. So that's one of the reasons I want to get into it, is because so many people are dealing with it. So I'm going to continue with this next time. Please join me then.